I was privileged to test out this new system at Bruker in Bremen last January, where I brought real samples with me, real tissue sections from patients, and to test out the capability of this new system. And the first thing that literally impressed me was the speed at which this instrument functions. The speed is the main advantage of this system, the second one being the spatial resolution that it can offer. So sections that in my lab took 6-7 hours to acquire only took less than an hour to acquire on this new system. So the speed is the first real major advantage that research in my lab could strongly benefit from with such an instrument. But if you look at the larger picture of what this instrument can bring you, one of the foreseen applications of imaging mass spectrometry is a true integration in the clinical setting, where it's a complementary set of information that is given to pathologists to better assess the health status of tissue biopsies and the health status of the patient beyond that. So we now have the possibility to process clinical samples on literally the time scale it almost takes for the operation to happen. We can think about a processing where tissues are sampled, frozen, cut, matrix deposition is happening, and data acquisition is all streamlined into an easy process that can take less than an hour, right? And this is really a time scale, a time frame, which is really highly compatible with the clinical setting. Most clinical setting applications happen with the analysis of a fairly large cohort of sample, where you can start out to pull out biologically relevant information, either helping you in diagnostic, prognostics, or response to therapy. So if all these samples are already available, in a matter of days, you can acquire the whole data set. Data processing, of course, will take some time beyond that, but at least you can acquire a consistent data set with all of your samples in a matter of days. So for me, that's a real throughput challenge right now, where in my lab with the current instrumentation I have, we're talking about several days to do this, where now you can condense it in a few days and obtain your biological answer at the end.